The University of Colorado Cancer Center is the only National Cancer Institute designated comprehensive cancer center in Colorado.
The UCHealth Pulmonary Nodule Clinic was founded in 2014, and at that time we only had a couple of providers that were only there about 1 day a week. And I was hired in 2016 to help grow the lung nodule program and to be able to track these patients over time and to also expand our lung cancer screening clinic.
We had a problem we were looking to solve. We had patients with incidentally found lung nodules that were falling through the cracks and weren't always receiving the care that they needed in a timely manner.
An incidental finding is an unexpected finding on a scan or test that you've done that was done for a different purpose. A lung nodule is a spot or shadow on the lung that is often an incidental finding on scans done for a different reason.
And we knew that we were missing patients because we would see patients that had prior imaging that showed a lung nodule a few years prior, and that lung nodule had changed over time.
Incidental lung nodules are most often not cancer, but some of them may prove to be cancerous and may often be early stages of lung cancer. This is significant because most patients with early stage lung cancer present without any symptoms, which is early stage is when they have the best outcomes and it's easiest to treat.
We were looking for something that didn't require radiologists to do anything different in their workflow. We were looking for something with intelligence that could really find these patients with incidentally found lung nodules. And then finally, looking for something with automation that could keep track of these patients and follow up with them if they were failing to follow up on their next steps. So we looked at our existing solutions and we came across Eon, and they truly had differentiated capabilities that allowed us to serve our patients and our clinicians in this way. Dr. Nina Thomas and Stephanie Brown have been fantastic partners in innovating and iterating on our processes and have really pushed the boundaries of the technology and pushed Eon to even improve their intelligence and their automation further as well.
Nurse navigators are essential to expediting and coordinating care for our patients, reassuring and educating our patients, and coordinating any follow-up testing to improve their access to care. They were the catalyst to this innovation. Some key results that we achieved was we had a 2,500% increase in the number of patients we were actively managing. 90% of patients returned for their next step of care. We diagnosed over 300 lung cancers, and most importantly, more patients were being diagnosed at an early stage.
We had a patient that came through one of our UCHealth urgent care centers with a cough that had been going on for a few months and just wasn't going away. And the providers there did a chest x-ray, which revealed a lung nodule. And this was captured by our AI software as a concerning lung nodule. The patient and the provider were both notified through our software. And then the patient was able to have a CT chest scan, was referred to our lung nodule clinic, and then we were able to get the patient in for a biopsy. The biopsy results came back as an early stage lung cancer, and the patient was able to get surgery within a few weeks of being diagnosed. Most definitely, without the help of this AI software, the patient would not have been diagnosed as soon, and the outcomes could have been much worse for this patient. And currently, this patient's cancer-free.
The Cancer Center has been very supportive with time and resources to support this growing program. They even ensured that we could hire a second nurse navigator to help support our patients and ensure their follow-up. They continue to support us as we continue to grow the program. Our future goals for the lung nodule program are to improve our abilities to predict and prevent lung cancer and shift the treatment of lung cancer to early detection and treatment. Given our success with the lung nodule program, we would like to expand our program to include thyroid nodules and pancreatic lesions.